Hi, I'm Dr. Stephanie Lamb here at Carnegie Women's Health. And today I wanted to talk about a topic that I think a lot of patients actually think about, and maybe not a lot of patients come to the doctor for. And that topic I think is preconception counseling, thinking about trying to get pregnant before you're ready to get pregnant. So we here talk to women of all ages who are interested in thinking about trying to get pregnant. And patients sometimes come in and talk about it at the time of their annual checkup. And I think sometimes patients call and make an appointment and come in for a sit down to talk about what they need to do, what they need to think about in order to be prepared for when they are pregnant. Preconception counseling is the fancy term, but in general, it's what to do, what to think about before you're actually and when you're trying to get pregnant. So if you think you're ready to try to get pregnant and you call, you can come on in for a discussion. And the first thing that we do is we look at your history, your age, how's your diet, how's your exercise. And these things are actually quite important to try to help you get pregnant, ideally sooner than later. Preconception counseling, ideally, women would be taking a prenatal vitamin for about 3 months prior to trying to conceive. And the reason being is in the prenatal vitamin, there's this thing called folic acid. Folic acid is extraordinarily important for pre-pregnancy and especially in pregnancy, because this folic acid will decrease the risk of something we call spina bifida, or an issue with the neural tube of the baby. And ideally, we would sit down and talk to you about the appropriate amount of folic acid that you should be taking. And then in addition to that, we'll go through, do you have any medical conditions? Are there any medical problems that you may have that we should try to optimize before you're pregnant? Do you have high blood pressure? Do you have thyroid disease? Do you have diabetes? And these are things that we want to make sure that are really well controlled before you do get pregnant. And that way the risk in the pregnancy is much lower when you finally are pregnant. If you're just a regular, healthy young woman, sometimes you don't need a preconception counseling appointment. But in general, things that you can do, or sometimes that will draw blood to check your thyroid before you're pregnant to make sure there's no underlying thyroid disease. In addition to that, there's genetic carrier testing that looks at your ethnic background to see if you're a carrier for any diseases that may impact pregnancy. There's a test that looks at almost 283 diseases, things like cystic fibrosis, Tay-Sachs, and depending upon your genetic background, you may want to get tested before. If you're positive for one of these tests, it really doesn't mean much for the pregnancy itself, but your husband or significant other would need to get tested as well. Because if both of you are positive for the same disease, then that would be a conversation that we'd want to have before you're pregnant. The test is an easy test. It's just a blood test. It's done here in the office. It takes 2 minutes to do. And the turnaround time is somewhere around 2 weeks. So when we look at patients who are trying to get pregnant, part of the conversation, those patients may be on birth control. How soon do we want to stop your birth control? How quickly can you get pregnant after you take out your birth control or stop your birth control? What vitamins you're taking, your diet, your exercise. And all these things that we talk about with you will help build to be a better and happier pregnant lady coming forward. So please give us a call here at Carnegie Women's Health. We'd love to talk to you.